Before starting my talk, I would like to thank Frédéric, Jean-Philippe, Vincent, all the organizers and the director of IRD for organizing and supporting this workshop or this seminar. And I also want to give you a welcome address in name of my colleague, Dr. Raman Velayudan, which is supporting this network with TDR. And Raman is the coordinator of the vector control unit in the neglected tropical disease of WHO. And I have a message from him, which is WHO has really decided to make a very effort on vector control. And the vector control unit of WHO, which, the vector unit of WHO, which are included both in the global malaria program, in neglected tropical disease, and in TDR, joined to develop a global strategy for vector control. And it will be presented at the resolution at the World Health Assembly, which is starting today. This is why I'm not staying more than one day, unfortunately. And we will ask the countries, France included, to support this initiative of a vector control global strategy. And this initiative also includes the insecticide resistance issues. And it will raise concern and it will raise awareness of the countries that this problem is really emerging in a way that we have to deal with it if we want to keep some tool for vector control in the control of disease, vector-borne diseases. So now I would like to present you not just the TDR initiative against Zika, but also all the activities that we have ongoing. And maybe before starting with the activity, if I need...
you should maybe go there.
I should to be there. Okay, if I want to. Thank you. So, and the microphone?
There is one here or one.
I take this one. Okay, thank you. So I would like to introduce you about what is TDR. So this is, okay, so TDR is a special program in WHO for research and training on tropical diseases. And this program was created more than 40 years ago now. And we have, you see, in 1974, with the objective of developing improved tools for the control of tropical diseases and also strengthening the research capability of affected countries. And the vision of TDR is that research and training will improve the health of the most vulnerable population. And what we are doing, what we call our mission, is to foster an effective global research effort on infectious disease, and a network on insecticide resistance is really part of this effective global research effort. So TDR is governed differently than most of the WHO unit, since we have a different contact with supporting member states. So the money of TDR is coming directly from some member states and from sponsors. And all these sponsors, member states, are gathering once a year in what we call the Joint Coordinating Board. The Joint Coordinating Board of TDR will happen next June, third week of June. And at this meeting, we are deciding the strategy of the TDR activities for 1 year and also for the following year. So we have a plan. And any activity that is undertaken within TDR or supported by TDR has been approved by this Joint Coordinating Board, including the activity as insecticide network. So this is just a way also to make you realize that this is not a side initiative. This initiative is known by all the people included in this board, and so it has a worldwide implication. So I'm not going into the lecture of the slides, you can do it be easier. So what we are doing in TDR, as I said, is making capacity for research, making research evidence, so supporting projects for research evidence and engagement of countries also. In each of the projects, we try to have stakeholders engaged since the beginning of the project. We are looking for solutions, going into practice, and impact is policies. So the results of any of the TDR activity should go at the stakeholders level and in the ministries, I would say, to be transformed into policies for improvement of the recommendation in vector control, but also on capacity building, on gender equity. We have several issues like outcome like that. So this is this one. Implementing the strategy of TDR is through two main work streams, which are research capacity strengthening and knowledge management. This is half of a budget going into funding training grants, capacity building in all the developing countries. And the second one is intervention and implementation research. We have a unit working on intervention research and operational research, and the unit I'm leading is working on vectors, environment, and society. And all these research units are addressing the interaction of disease transmission, of all the factors influencing disease transmission. So, what is Vector Environment and Society Unit? The context is focusing on vector-borne diseases. What we want to have as an impact goal is that the communities have an enhanced access to improved control interventions that contribute to decreased transmission of disease. And what we are doing as activity is promoting research, building capacity, and collaborating with countries and institutions. So, I don't know, this is the plan for the network itself, but this is also the plan for TDR to disseminate all the information that will be built from this network at the capacity, at the country's level. To be a bit more precise, we are supporting scientific knowledge, which is production of scientific information, publication, the usual research activities, I would say. But very important for us is also to support capacity building. All the projects that we have include some students training and sometimes training for health professionals, not just in research, but also in public health. And we are going also to policy recommendations. That's all the project should be translated into policy recommendations. And that's the VS activity. So we have recently reorganized our activity in two main work streams. One is on environmental changes, one is on emerging challenges, the other one social and community dynamics, which is also a very important part of our activity. And finally, we have reorganized one part of our activity on looking at gender equity and ethics, because it has a strong impact on the disease control. This is also in line with not just WHO recommendation, but United Nations Sustainable Development Goal that are starting this year. And you know that all activities of the United Nations are to be responding to the goal. In the past, we had the Millennium Development Goal, and now we have the Sustainable Development Goal. And the goal number 3 is that the goal number 1 is reduce poverty, and the goal number 3 is health. That everybody should have access to health quality, I would say also. This is a map of the geographical distribution of the VS project. As you see, we have project mainly in Africa, because this is the place where you find the most vulnerable populations. We have many projects in South and Latin America and the Caribbean. And we had in the past quite a few projects in Southeast Asia, but then we had a kind of break. And this year we are starting two projects in Southeast Asia again. Just to give you a brief overview of the project that we are working on, we have one project which is funded by the Canadian Development Agency for 5 years research project. So this is 5 projects working on 7 African countries and on 4 diseases. And these projects are looking at the resilience of vulnerable population to climate change. And as you see on these 5 projects, we have research teams working on human African trypanosomiasis, malaria, schistosomiasis, and Rift Valley fever. We have another big project on malaria, which is in collaboration with our colleagues from the Global Malaria Program. I don't know if you know, but the Global Malaria Program estimates that malaria should be reduced by 75% in the next 10 years. And we are looking for 90% of malaria reduction by 2030. This is a goal, and what they are facing now is a problem with what we call residual malaria. In many countries, even if the malaria control measures are well implemented, if we don't have resistance, we still have ongoing malaria transmission, and we don't know why. Maybe a change in the mosquito behavior, or maybe a change in the population behavior. So we are funding 5 research projects to look at residual malaria. 2 in Africa with 5 countries, 2 in Asia and Pacific, and 1 in South America. Brazil and Peru is the project. So now back to Zika, because this is also the big problem actually. I just want to make clear that what WHO has declared as a public health emergency is not exactly Zika, but is microcephaly linked to Zika infection. And this is the first time after the Guillain-Barré we have in Polynesia that we have an arbovirus which is creating such a big problem for the people affected and the family and the communities. I'm sure you've heard about and you know about what happened with microcephaly. And microcephaly, we are just scratching actually what is the top of the iceberg, because we know that we have some newborn that are dying because of this microcephaly, some others that have very bad debilitating consequences, but we don't know all the consequences. And we still have now maybe the idea that some of the baby that have been infected by Zika in the mother may have some disability, like being deaf or having some nervous disability that can go on until the age of 8 or 10 years old. So we really don't know what will be the consequences for these children being infected by Zika. And this is a really bad problem, not only for the children, but for the family, because most of these countries do not have any facilities to take in charge babies or children with disabilities. And then the community, the families have to get organized, and the health system also do not have the capacity to face this big problem. Just in Brazil, I don't know if you know that, but we have something like 1,500 cases of microcephaly. And this baby need a lot of care, a lot of money, a lot of health system prise en charge, take care. So these arboviruses is in a way, as for consequences, worse than chikungunya and also worse than dengue, because dengue is a huge problem because of the dengue hemorrhagic fever, but the consequences usually doesn't go for life. And in this case, we really don't know where we are going. As you see here, this is the last WHO Zika situation report dated 19 May, and they put a line with the events starting from the first events in 2013 in New Polynesian and going until May 2016. And then you have the evolution and the repetition of the cases and the number of cases, the number of countries affected. And as you see, America has almost all countries affected. In South America, we have Uruguay, and I think Uruguay is also affected very, very recently now. I think we have cases. And Chile, that is not reporting cases. All other countries are reporting cases, including Central America, Caribbean, and some circulation still ongoing in Southeast Asia and the Pacific region. So what kind of activity are we doing in TDR for emerging arboviruses? We have, as I said, a big project, a big program on social determinants of community participation. And we have one social scientist working in the VES team, which is managing these activities. And so this is a result of a project that was ongoing until 2014 in Latin America for dengue prevention. So we have from narrow to wide community participation with several steps. And then we have now the scaling up of this community participation project in 4 countries in South America. And for giving you an example of this type of project, in this project you have several types of vector control activity or vector prevention, like window and door screens, long-lasting insecticide nets, targeted intervention on the most productive containers. This is for Brazil, for example, and the activity is also summarized here. And what will be interesting, I don't have the slides, is that this scaling up of dengue intervention is actually ongoing where we had the Zika also. So we have control area and we have area that are surveyed, where the scaling up is ongoing. So we may have some tools to compare if this scaling up or intervention may have an efficacy in preventing disease transmission. Then another project that we are developing also from last year is urban health. You know that there is an increasing problem with urbanization. And so we have already selected the same activity more or less than the WIN network, but on urban health we have selected a consortium of institutions to conduct a research gap analysis on the main research that should be conducted as priority research in the urban health context. And some of the research team are already here for goals and outputs. So we think that what we need in the future, very, very soon, is urban intervention packages and maybe innovative housing protection. And we have to include also, again, multi-stakeholder partnership with community-based delivery options. So now another initiative that is ongoing is the Caribbean Network on Emerging Vectorborne Disease. And yesterday, I arrived yesterday from, and I was with Isabel also, we arrived yesterday from this Caribbean Network second workshop. So we have supported this activity because we have realized that the Caribbean countries, the Caribbean region, is really a strategic region for the emergence of vector-borne diseases. So the first dengue hemorrhagic fever arrived in Cuba in 1981. Chikungunya arrived in the America through the Caribbean in 2013 through the island of Saint Martin. And now Zika arrived through Brazil, but when the big epidemic will be out in Brazil, the Caribbean region is one where it can persist because there are very small scattered islands and the transmission is different. And if the vector is most of the same because it's Aedes aegypti, we still have Aedes albopictus in some of them and not Aedes albopictus in other of them. So this region is really strategic, and it has also many different facies, many different characteristics. You have humid island, dry island, different ecological conditions, different cultural conditions. So it was an area where it is really interesting to try to put the countries together and to see what they can do together to prevent the emergence of arbovirus disease in the region. So it started with the first workshop on surveillance and diagnostic in Trinidad in December. And for the first time, all the countries and territories of this region were represented in this workshop. And we had a kind of emotion when Cuba said that it was the first time they were invited to a meeting in the Caribbean region, because you know the Cuban situation, and they have been apart for many, many years, even if they have very, very good institutes like the IP Curie Institute, which is doing such great work on vectors. And so this is an initiative where we are trying to build together some arbovirus prevention and ethics with respect to the countries involved, from the poorest one, like Haiti, like Cuba, to the richest one, like Bermuda or Barbados. So, another initiative that is ongoing actually and started last year is the development of a platform on courses on vectors for low and middle income countries. We realized that I think this happened to all the entomologists working in this room. We have sometimes mails, often mails from students or stakeholders that are looking for a specific course. I would like to get information about the bugs, for example, for Chagas disease. Where do I go? And so we don't have any tool to really answer all these questions. So we thought that it was a good idea to support the development of a platform where all courses of medical entomology could be available, not online course, but at least the CV, the information, the cost, the dates of the course. So we started this activity by hiring a consultant who made mapping of the available courses worldwide, and for the first time we have an exhaustive list of the courses. There are 165 courses worldwide, but on this number, only 65 are real courses, and the rest is few hours in the courses of parasitology, another few hours in the courses of medicine, another few hours. So it's not a real course of medical entomology. So, but 65 of them are named courses of medical entomology. And IRD was also a member of this initiative, and we had the first workshop with about 20 institutions. We tried to have the big ones, like the two London School and Liverpool School. And we tried to have also the one from Brazil, like Fouque. We had a big one from Argentina, a big one. We had John Hopkins. In France, we have IRD and Pasteur. So this workshop was to set the platform, to set the baseline of how this platform should look like, how it could be developed, and what would be the term of references, and so on. And so now the next step is to open a call for the selection of a consortium partner to develop and host this platform. And now with my colleague from the Research Capacity Strengthening Unit in TDR, we are looking for the funding to support the development of the platform. We are quite confident that we should find some funding until before the end of the year. And so the outcome should be online availability of the courses for students. So again, this is not online courses, but online information of the courses. And we want to open also the platform not only for students, but for stakeholders, for physicians, for any people that could be involved in vector-borne diseases. And the second one would be maybe, if this platform is working well, the possibility of harmonization of some of the courses. If the institutions that are giving the course agree, why not trying to harmonize and to have some online courses, some MOOCs, also available in the platform. But that would be the second step, really. And where do I am? Another project that we start this year is environmental health services in Southeast Asia. So we will open a call mid-2016, so where we are May, should be around July or August, to fund 2 projects that will be working on environmental risk on vector-borne transmission, one in rural communities and one in one in Zero, so Southeast Asia, and one in Western Pacific, to better understand how environmental changes, not just climatic one, but agricultural one, deforestation, and so on, can influence the transmission of vector-borne disease in this part of the world. Votre batterie est faible. So I'm almost finished. I have 2 more slides. Now I just wanted to, but you already know that, I guess. This is another initiative that we are supporting, the development of a network on surveillance of insecticide resistance for vectors of vectors of arboviruses. And the countries that are participating are in bold, so USA, Brazil, French Guiana, France, Portugal, Madagascar, Mali, Singapore, and I think this is all for the moment. But the network should be open to much more than this main group. And hopefully we would have, at the end of this activity, which is for 1 year at the moment, really solid ground for building a more open and worldwide network. And the goal, I don't know if I already speak with the PI with that, is to link that also to malaria vectors, because we have a lot to do in common. So I will end with what we are doing for Zika specifically. So for Zika, as we told you before, we have a public health emergency. So WHO draft a plan for a response strategy, and in this plan it has 3 main topics. One is surveillance. So we are working on building surveillance, diagnostic, rapid response tools. Response include risk communication and community engagement, vector control and personal protection. This is where our vector control working group in WHO is working. And management of complication, very important, because we don't know now how to manage the complication of microcephaly. And we also have an issue for research. And in research, we have public health research and product development, which are 2 different things. And with the vector control group, we are working on public health research. And now I want to end with showing you what we are doing in this vector control group in WHO. So the key activities of the group are to update all the guidelines on emergency control and surveillance, disseminate recommendation, support insecticide resistance monitoring, A few trainings are ongoing, in particular in Latin America, to train people to test insecticide resistance. And we realize that we have less and less people that are properly trained. We have a real lack of entomologists in this region. And supporting countries also in vector surveillance and control, integrated vector management, and provide proactive special care. This is adequate repellent and treated mosquito nets for pregnant women. So this is operation, and this is research. And in the public health research activities, we have defined 3 research priorities. And as you see, the first one is insecticide-resistant impact on vector control. Because we really don't know how the vector control is working and how the insecticide resistance is impacting the efficiency of this vector control. The second priority that was established, the research and new indicator for entomological surveillance. We are working since 50 years on indices. Brutto indices, house indices, container indices, but none of these indices are, first of all, related to the adult density, and secondly, related to the transmission. So we really need new indices. And if we have the money, because this is always the case, we will open call for having research project on new indicators. And the last one, which is, as you saw, quite an important part of the VES activity. There are investigation and community-based vector control strategy, taking into account social and cultural differences. We are working in countries speaking in at least 4 different languages. We have English, we have Spanish, we have Portuguese, we have French, we have also Dutch in the region. And all these language differences are also translated into cultural differences. So the approach to taking care of the house, getting rid of the mosquito breeding site is not the same. And also the approach of making recommendation is not the same. So I think this is all. So thank you very much for your attention. And this is a TDR team. As you see, we are a small team, 30 people. We are not doing research ourselves. Personally, I did research until I joined TDR, so for 25 years in the PASS Institute network. But then, since I'm there, I'm supporting research, and I know how much it needs support. So, thank you very much.